Thanks very much, everyone, for joining us. This session is, as we were just discussing, something that came up as the conference was emerging. So I'm really pleased that we were able to put this together. And really, it is a little bit of a demonstration of what a community of practice can do, where Dr. Ghanwat is someone I knew because we went to university on the same scholarship, and our colleagues at OPM were able to reach out to Katie and Srinivas because they knew of the work of Janaagraha. And really, this sort of symbolizes how quickly communities can self-organize and make meaningful work happen or conversations happen. Cornet has been, one such evidence for us. So Cornet is a community of practice. It started in May 2020 when pretty much when the pandemic was emerging and there was a felt need for researchers to come together to share not just research, but also to learn from each other, particularly because a lot of research methods were changing, people's questions were changing, and so on. So it really started to foster exchange, but then over the months, we've also been able to slowly deepen collaboration between partners. So yeah, Quicksand, which is a design research agency, anchors the Cornet community. And at the moment, we have about 60 research organizations. We also self-organize on Slack, where quickly you can message people across the network. And there's a web repository that we've built together. It's on www.cornet.in. And through the last year, we've also been meeting quite regularly. So we did what we call coffee hour sessions, where members could share with each other their work. And that became the first sort of touch point for people to get familiar with each other and then start having deeper conversations. The conference really came together when we felt like as a community, there was a need to share what we've learned in this past year collectively. So some of that intention you see in the way that the plenaries are planned out in the afternoons. But at the same time, we thought, particularly because lots of this research has been recently done, we will also use the morning sessions to do showcases and dialogues and create opportunities where still serendipitously researchers come together and interesting things come out of that. So this is certainly one such example, and we're really grateful to the team at Janaagraha as well as Dr. Ghanwat who could make it today. So if you go up, Nitya, just one slide on the ground rules, I'll just share with you what we have planned. No, just one more. Okay, great. We are recording this for documentation. It will go on the internet for people to see. And particularly because this is a difficult time, we had more registrations, but we're recognizing that people have to attend to more important, urgent things at the last minute. So which is why you see the numbers aren't great, but we're really grateful for everyone who can make it at this point. For active consent seeking, we are removing chatbots from the chat section, but I don't see any, so that's great. Please turn off your video if you're not speaking. Most of us can speak Hindi or English, and we should also be able to provide live translation in case that's required. So please feel free to use the language of your choice. There is a chat box for your comments and questions. Please use that liberally. Even as people are presenting, it's totally fine to leave your comments there. We can come back to it during the moderation. And finally, we are at about 9 minutes past noon. This is anyway, I mean, it ends at 1 and there's nothing beyond it. So let's see if we want to extend it. But yeah, I mean, we have roughly the hour to construct this conversation between us. Great. Nitya, if you could take us to the agenda quickly. Yes, thank you. So we'll have Dr. Ghanwat who'll speak with us for about 15 minutes on some of the really interesting experiments, if I can call them that, or projects that he led with his team in Assam. And then we could have the Janaagraha team share some of their work. And then finally, Srinivas from the Janaagraha team will try to join the dots and connect how most of these conversations are really speaking with each other in one way. If you go next, Nitya, I will quickly just take a minute to share with you about all the speakers for tonight. For today, sorry. Dr. Ghanwat is an IPS officer of the 2010 batch, born on Assam cadre. He has diverse backgrounds and formal training in not just medicine, police management, but also science and technology and philosophy. He's an active member of the Assam Science Society and also takes a deep interest in technology for development. Katie here has more than 18 years of experience in a combination of project management, social research, and research implementation in the UK, in the Netherlands, and in India. At Janaagraha, Katie heads the research team, which provides data and insights into urban governance issues, thought leadership, including regular publications, and supports Janaagraha's programs looking to improve urban governance in India. Srinivas is the head of civic participation in Janaagraha. He leads the efforts in increasing civic participation in governance. Srinivas drives design and development of Janaagraha's civic tech platform, which is I Change My City, which has been a pioneering tech platform which is used by thousands of cities across India. Used in thousands of cities across India. I'm reading it for the first time, but this is really impressive already. But most importantly, I think Srinivas was one of the founders of the Steel Flyover Beta movement in 2016. And I don't know how many of you know this, but I thought this was a pretty significant moment in time for Bangalore, where the community came together and they were able to make Bangalore livable, sort of turn over the conversation around creating the Steel Flyover. So just over to Dr. Ghanwat to share his thoughts with us, and then we could move on to Katie and Srinivas.
Yeah, thank you so much, Rohan. So I hope I'm able to bring on table the perspectives of the policing. Why I say that? Because police was one of the important stakeholders in entire pandemic management last year, and it continues to be so this year. Perhaps there is some internet disturbance. In case that is, maybe I'll change my network connection. So when I say that, we had a lot of problems in policing. Like this is on an optimistic note that I'm thanking coronavirus, because it has set a reset button and on everything and forced us to rethink our strategies. It has given somewhat positive image to policing, and that's what I gathered from Janaagraha's wonderful research, which we'll learn later on also. It is sort of, I thought, redefined the police role in social orders, in particularly in last 12 months. If you can see, there's complete sort of different engagement with the public that we feel post-corona phase 1. And I always feel that the stress and fitness importance among the people and among the police is increasing. So that's why I just wanted to take a minute to thank this poor virus. Now, what are the challenges that came our way? The first and foremost challenge that came police's way last year and continues this year is that we were asked to enforce the general lockdown. And this was very different from what normally we enforce. Normally, we are used to impose a curfew which is in a pocket of area or jurisdiction, and we just cordon off that area and then facilitate the movement. But this time it was all over. And this time, secondly, we had to allow some people who are of the emergency nature, and few were not allowed. So how to identify those who are there? So we had to evolve a mechanism of passes. Then we were not sure how strict we have to go with the people. Initially, people would resist because it was also a natural reaction of them. So that is the reason police had to be harsh at times initially last year, if everyone remembers. But then quickly we aligned ourselves to the requirement and goals. And thirdly, like we could not really touch them physically because of the problems or the vulnerability of policemen in getting infected themselves. So this gave us the third challenge, which I have written to the right side of the screen. Personal safety of policemen became a challenge in itself. And another set of challenge which government gave us suddenly was to monitor the persons who are placed in home quarantine or isolation. To monitor them, to do their contact tracing was very different from doing the routine contact tracing of the criminals. So the way at least my district unit and my state police went around, I'll just share my perspectives. So we did some innovative experiments around it. For the sake of general lockdown, we quickly came out with two innovative projects called as e-Naka. So all our Nakas were made electronic Nakas. We just used low-tech open source Google Forms technology, and we entered data of every vehicle that was coming through. That helped us eventually in the data processing as well as contact tracing. We could precisely tell at what time, with the timestamp, which vehicle carried how many persons and entered inside us and what phone number they did. So that was a wonderful thing we did. We were backed up by the Epidemic Act laws, and we could do that. The second project we thought we did was about Pharma Sentinel. So we took all the pharmacists in our district in confidence. We passed a magisterial order, and we gave them Google Forms to fill up every time somebody buys COVID related or coryza or common cold or fever related medication over the counter. So that was basically to check such people who are escaping the government net they don't want to test themselves, and they simply go and buy the medicine over the counter. So we would get their phone numbers and data and their addresses, and somebody from the administration would call them and then get them tested and get them inside the fold. So that was another manner of getting the intelligence from the pharma shops. For monitoring the persons in quarantine and isolation, we you devised a method called COVID Sentinel project, and that went on to become one of the successful projects, which I'll be sharing in a couple of minutes ahead. And for taking care of the personal safety, we devised COVID Cop Care, in which we distributed certain instruments to all the police station levels, and we measured the basic vitals of every police personnel during the evening roll call, and we would get them. And based on this evidence-based, health parameters, we devised and rotated their duties, and we counseled most of the police people and their families. So I'll come back to the COVID Sentinel, which was more collaboratively done by us. So it was COVID Sentinel. We used 3-layer strategies. So one was active monitoring. Active monitoring was done by a set of volunteers, and that is where I'm coming to. So we mobilized volunteers from the community. These volunteers were mainly the teachers, professors, shopkeepers, homemakers, students who were locked down in their respective houses. So nobody was required to step out their houses. So they did entire thing sitting in the confines of their houses, just through their mobile phones and internet connections. What we did essentially was we took the data of such people who were under the home quarantine or home isolation from the health department. While taking this data, we signed the ethical and the non-disclosure agreements between these volunteers and the government. And then we distributed this data for every volunteer. So every volunteer would get a set of 10 phone numbers of such people who are to be monitored. And that was done taking care about their linguistic affiliations. So mostly that care was taken that people speaking Assamese would get the Assamese. Assam has a lot of lingual tongues like Bodo. We have missing language. We have Bengali language, we have Hindi language, we have English. So a whole lot of them. So we took care that this conversation happens, facilitates essentially in mother tongue. And then they were required to call them every day, once or twice, and then do some interventions, which I'll come back. The second layer of the strategy was by passive monitoring. So through a private company, we devised a monitoring app, which was installed by our volunteers on their mobile Android phones of every person who was under the monitor. And this app would generate an alert the moment somebody jumped a perimeter of say 150 meters, which violated the guidelines. So immediately somebody from the police department would pay a physical visit and ensure that this person doesn't violate. So the very thought that we are being monitored gave a great compliance. And last year it was like we could defeat the virus, I thought. And the last strategy was through active care, which some police personnel or the administration personnel went to doorsteps of people and delivered. So these are the interventions which our volunteers did. Every time a volunteer would call his or her set of people, and this calling would be for a period of 7 to 10 days. So every day they were required to monitor the compliance. So we would take the location. Sometimes we would ask the person to show, videograph himself and show, or it could be a live video call or relay the location. We'll just ensure that the person is staying inside the house. The do's and don'ts were explained in mother tongue. So there would be a lot of questions initially. So what is quarantine? People did not know. What is exact sanitation? How to wash hands in what is the scientific manner? How to wear the masks? People would ask, could we share the plates? Could we share the mobile phones within the family? And so on. We would inquire this with human heart, because last year Assam government gave a very catchy and very practical tagline that COVID care was with human heart and ruthless enforcement. So we sought both these things to be accommodated here. We would ask them about their problems. Most of them were economic problems, medical problems. Like somebody doesn't get the ration, somebody's otherwise a cancer patient, heart patient is not able to access the medical facilities. So we could extend the telemedicine facilities to them and psychological counseling through the counselors who were qualified counselors or who were trained by us later on. In addition, at the end of these 7 days or 10 days, when there was a very good rapport between this volunteer and the persons, we administered a questionnaire to the people in general, and the answers were then data entered into the Google form, which were collated at the back end, and we could come out with very precise research outputs, which I'll share. At the end of this entire project last year, we kept the data because we had a documentation cell, we had HR cell, when we had IT cell, and so on and so forth. So we calculated that we reached out more than 35,000 people's lives, and there were stories like people were really touched, like somebody's elderly, somebody's not having anyone people were in utter distress. So somebody calls them from the government side or from the NGO side and then inquires about them. So there were so many funny stories, so very sad stories. And these stories were made through around 2.5 lakh phone calls or video calls. There were about 500 volunteers overall. So at a time, typically 250 volunteers were working, and they were being rotated. Somebody would not give entire time. So there was a journey. So our HR would constantly recruit them. This recruitment was happening either through social media handles or we devised a portal from government of Assam and requested people to volunteer, and then we reached out to them. And the third mode, which was most successful, is that we would request the people who were benefited to again join us as volunteers, and that really paid a lot of dividends. Now, to motivate such people, we conducted so many webinars. We invited people, prominent personalities like sports person Hima Das, or we have Forest Man of India, Mr. Jadhav Payeng, the local representatives, the police officers, the film stars, the singers, and we every Saturday we held a online evening get together, and just to boost the morale. That was really important, I thought, because it was entirely volunteering activity. We did not pay any remuneration per se to any person. It was just the sheer joy of working together and contributing to the humanity. Of course, our DGP and the government of Assam extended certificates of gratitude at the end of this thing. But then it was very important for us to keep the flock together, because overall there was a melancholy, and it was difficult for us to motivate people. We could troubleshoot food and distress calls more than 1500. We reached out psychological counseling and telemedicine to that extent. We also generated research outputs. So like I said, we had the precise data, and we had some researchers. So we took help of the ACE researchers from Assam Medical College and conducted few researches. Government sometimes asked us whether is it safe to home quarantine people who are asymptomatics. So we would check the health policy of government and give them the evidence-backed data. So we said yes, and we came out with the precise data that 4% of the asymptomatic patients transmitted this disease. We could do this because of the inquiries. We would ask how many people are asymptomatic and in your home, and what are the next infections. Then another set of study, we questioned the government's strategy of having the common toilets in the institutional quarantine facilities, and immediately this common toilet strategy was revised by the government, and it was ramped up. We also submitted a couple of reports to government and gave several recommendations which were accepted in toto. But this entire thing was evidence based, and that is what is important in the pandemic times, because there tends to be a lot of chaos and confusion, and so many theories and hypotheses floating around. It's very important to make sense out of it, run the statistical tests around it, and then come out with the policies. I'm just sharing some of the simple researches that we could come out. We could show to the government what was the exact age group. This is the last stage age group, and I was reading somewhere that this COVID pandemic too is morely affecting the age group which is younger generation. Even the children are getting affected. Then this slide shows number of distress calls that we got mainly for the financial help or medical. So what people want. So 26.7% people were in psychological distress. So this COVID is not only physical illness; it is essentially a psychological illness, and it tends to be overlooked. So that's an important factor. We told to the community then what kind of psychological illness they had. So we classified it for the sake of the psychiatrists, that 10.6% are feeling depressed, 35% are sad, 6.4% are unusually angry. So that could devise the strategies. Anxiety was there, and then yes, 2/3 people successfully installed our app, geofencing app. There are some media coverages we got. So what are the lessons learned basically? And the first and foremost lesson was learned that the spirit of volunteerism can do wonders. And then it is very important that when GO plus NGO plus corporates, I mean the private company which donated this app for us, designed it very quick time. If these three sectors come together, nothing like it. Wonders work, because we in government have our own limitations. Now, when we get the people's participation in a very channelized manner, then it is like a force multiplier. Then entire thing was done in a very low-tech manner and a very cost-effective manner, because we did not engage any big things. Now we are thinking as to what kind of strategies, how do we cross-pollinate these learnings into other areas. So government has asked me, my DGP has asked me how we can make use of such a social call center, as I'm preferring to call it, this thing strategy to other departments. So other areas where we are now contemplating is to audit the social audit of the government schemes. We could ask the people who are victims of various crimes whether they are satisfied, whether their schemes have gone ahead, because this is a model in which you require the data of the beneficiaries beforehand, and it is putting things exactly on the top of the head. Usually we have one helpline number and we expect people to call in and then we troubleshoot their problems. Here we are proactively calling them. So it is essential that you should know whom to call. So it may not be as helpful in a manner like natural disaster because we don't know who's affected. But all those areas where people are affected, for example, de-addiction programs, we already know who are the victims, and then somebody needs to call them, just like Alcoholic Anonymous does, and then share their own experiences with them, and draw some research outputs in a remote manner. If we can do some mentoring program similarly. So we are thinking on those lines. These are some other initiatives. I'll not waste time. It was the e-Naka. So simple Google Forms, and these are our e-Nakas. These are the backend things I was talking about. We got the precise data. This was Pharma Sentinel, which the pharmacist generated the intelligence for us. So which medicine was bought by which person and who prescribed it. And this was the backend thing. Somebody would call them and nobody escaped this night. This was the COVID Cop Care initiative. We took care of police personnel. And that's it from my side. Thank you very much for this opportunity.
Thanks so much, Dr. Ghanwat. Over to Katie.
Thank you. And thanks so much, Dr. Dhananjay. It's such interesting oversight and so much really complements a lot of the things that I'm going to be talking about, obviously from a slightly different angle. So just as a little background, Janaagraha, which is where Srinivas and I are have been working with the Bengaluru City Police for sort of, since 2013, I think, on a community policing program. So that's where we have been sort of facilitating and helping the Bengaluru Police set up this program where there's a greater use of citizen volunteers who basically help the police to kind of decentralize their operations and stimulate information flow sort of from citizens to police and from police back to citizens. So I don't want to spend too long on setting the context because Dr. Dhananjay set an amazing context already about kind of the situation of the police at the time of the initial start of the pandemic and obviously ongoing as well. What I'm going to talk to you about is some research that we did in Bangalore to really understand a little bit more about, what was the perception and response towards policing and the police during the pandemic, given the complete sort of new set of circumstances that the police were working in and the needs of citizens and things like that, and then how that kind of was embraced given the sort of already embedded community policing kind of approach that sits within the Bengaluru City Police. So really looking at how this was rolled out, what was working well and what didn't work well, and particular focus on these kind of partnerships with individuals and members of the community as well as civil society organizations, and thinking about how we can kind of capitalize on those learnings, and obviously very pertinently so as we're in the middle of a huge second wave of COVID now, even while we're in sort of slightly different kind of lockdown circumstances. So what we did, we undertook surveys with three groups of stakeholders, and we did this in October, November. So just as a kind of side note, we really are talking about their experiences in the initial lockdown in the very first wave around sort of September time, and not anything more recent than that. So we spoke to or we surveyed over 500 citizens in Bangalore, and we did qualitative face-to-face interviews with 24 police personnel, and also a very small sample of citizens in the city who are affiliated with a civil society organization or were actually volunteering during the time of the pandemic specifically. I'm just going to launch straight into the findings. And I think Dr. Dhananjay also mentioned this, while the police, there was no change to the fact that they had to do all of their normal activities. They, in addition, had suddenly this huge additional volume of activities, enforcing all sorts of things to do with the pandemic, rules and regulations, becoming educators. So all things from, enforcing the mask wearing to traffic and travel management, ensuring that shops were closed at the times they were supposed to be closed, making sure that curfews were adhered to, and at the same time also helping citizens, access their food, their medicines, anything that they need. And as Dr. Dhananjay also touched upon, this huge welfare responsibility towards their own, the police themselves. Really, they had to think about those things far more now as well. And actually, the vast majority of citizens and civil society organizations were able to kind of understand all of these additional responsibilities. There was a great understanding that this was now the duties of the police, and that, this would have challenges for the police, because they were working longer hours, they didn't have the time off, they may be suffering all sorts of anxieties about catching COVID-19. I mean, how do you enforce law and order when you can't, or you don't want to touch people or get too close to people and things like that? And there was, our surveys found a lot of understanding from citizens about this, the position that the police were put into. So also context set, as well as the things that I'll talk about in terms of this kind of, harnessing of volunteers and civil society organizations, the police response, was very wide and diverse. And this is what the police in Bangalore told us, which was about, a lot of changes to the way that patrolling was done, a huge amount of increase in communication, social media posts and campaigns, vehicle addressing systems going around the city, giving information, distribution of brochures and other sorts of information, and as well as kind of technology, because crimes and types of crimes were changing and people were indoors. There was a great change in the way that crimes were actually reported, a lot more by phone, a lot more online, digitally, and things like that. So apps and digital communications were also really increasingly used in the response to the pandemic. And the police did a lot of targeted engagement for particular groups like the women, elderly, urban poor, daily wage workers, those with particular medical needs, and of course migrant labourers. And these kinds of things covered everything from food, shelter, medical care, sanitary hygiene, and travel assistance. What was interesting was that we found that very few citizens sort of recognised actually the police's role in helping migrant workers at that very early time in the very initial lockdown. I think they didn't see the police's role in that, which was interesting. Now, what I'm going to come to is that the police formed in Bangalore many partnerships between themselves and others to provide these kind of strategy, to revise their strategies and provide this kind of relief. So everybody from, the BBMP through to transport agencies, there were a lot of partnerships ongoing to ensure that all of this was well coordinated. And at the same time, which is where we're going to get to, is that there were increased partnerships with CSOs and later, as I'll mention, volunteers as well. So with CSOs, many CSOs already have an established working relationship with the police in Bangalore. And so, this was kind of like a natural, organic extension of that in them offering that. But it was mostly the CSOs themselves offering and suggesting that there could be things that they could particularly do. And what was interesting was, for example, that CSOs could point police to where, there were groups of people in need. They could say, okay, well, we know that people live here and here and here. And then at the same time, the police would then essentially provide the safety for those organizations, the safe passage to deliver food and relief and things like that. And one of the things that these CSOs actually said to us was that actually, going forward, we could really distribute this in a better way. If you bring on board more CSOs, the CSOs can form the humanitarian aspect of kind of relief during something like a pandemic or any other kind of crisis, so that the police themselves could focus more actually on law and order issues. And then citizen volunteers. So in Bangalore, although the community policing program is there, the police also put out an additional call for volunteers, and many citizens came forward, and they were then brought in and well coordinated into this sort of established network of volunteers. And they were harnessed to do a huge amount of different things, from kind of, checkpoint checks and passes, through to kind of just helping people access food and medicine, through to, the verification of citizens and needs and things like that. And the police themselves said they really greatly facilitated this communication to every corner of the city. So this is really obviously the idea behind this kind of network, and it really worked. They were able to pick up pieces of information from every corner of the city. There were some issues with the general public kind of questioning the credibility of citizens and acknowledging them in their role, wanting sort of verification that these people really were working with the police. And that's something also that Dr. Dhananjay and I were talking about yesterday in our pre-panel discussion, is how can you sort of ensure that you keep that credibility for citizens, especially as we go on now into another wave and going on into general everyday policing, is if you want to bring citizens into this model, how do you make sure that the general public kind of accepts them as part of that model? Okay, and you know, coming to the crux of this is that all of these things seem to have really worked very effectively to bring citizens and police close together, sharing information on their needs and helping to build trust. And I'm going to take you through quite quickly, just I know in the interest of time, just to show you some of these overwhelming statistics about you know, what happened. So really, almost 2/3 of citizens in Bangalore interacted with the police during the pandemic, right, which is more than ever before, right? As you can see here, there were kind of 3 types of interactions. So that was citizens going to police to ask for help or anything they needed, police approaching citizens for whatever reason, and then also citizens engaging with volunteers. So 3 different types of interactions, and all of these interactions were felt to have been extremely positive. Like the kinds of things that were written were, you know, I think in the case of citizen volunteers, I think over 90% said that, you know, their query was addressed, their problem was solved. You know, the police were described as helpful, patient, kind, attentive, you know, going out of their way to do anything possible to help them. So it was extremely positive. And as you can see, it also translates into the fact that sort of citizens felt and could see a huge police presence on the street, you know, greater than ever before, as this graph will show you. And, you know, again, the majority of citizens felt that the Bangalore police did a really good job, you know, are doing a good job during the pandemic. And this was echoed also by the people that we spoke to from civil society organizations. And in turn, there's actually sort of a huge shift in the perception of police as compared with before the pandemic. You know, 90% of citizens feel more positive now about the Bangalore police than before, which is huge. And there's a similar shift from civil society organizations as well. And what is really interesting as well is this shift in, you know, what eventually sort of matters most to citizens is that they feel safe and they feel well cared for. And, you know, as well, there's a huge shift in how safe people feel. And what is most interesting, I think, in this sort of equation is that those who interacted with the police or a volunteer during the pandemic are actually much more likely to feel safe than those who didn't interact with the police in that time. So it really shows the unequivocal need to have that kind of engagement, to build trust, to build relationships, to share understanding of situations, and that can really breed feelings of safety and security. So that's a really pertinent finding. And at the same time, the police themselves also noticed this huge public shift in perception of them, you know, and they felt that equally from citizens across different communities. And they said that reasons for this is that citizens are more aware of the work of the police. You know, the citizens were reliant on police for many things in that time. The police were available for them. There was greater engagement between the 2 groups, like I mentioned, and there was a lot of humanitarian work that the police were doing. And essentially, they were risking their lives. You know, at that point, especially when we didn't know that much about the virus, they were really very much the only people in the front line, and they were supporting communities equally across the board. Just some final thoughts. As I said, there's a huge shift in how the police and policing has been perceived since the pandemic has hit, and that's particularly the case from citizens. And this kind of effective engagement between citizens and police has really been like a driving force behind that. And what has driven that in turn has been these citizen volunteers and civil society organizations that have been working in partnership with the police, and really embodying that kind of spirit of community policing, which has been growing over the last few years. And again, like I said, you know, when citizens understand police better, you know, the police themselves said that can really help shape the perceptions that the general public have. You know, it's really important that we build on this. And again, as I said, very pertinent now as we're in this terrible second wave. We really can think about re-energizing this kind of program, this kind of citizen volunteer decentralized program to really ensure that we get this sustained police presence on the ground, whether it's through police themselves or volunteers, and that deep engagement to really understand the needs and issues in a hyperlocal context, so that you can really like have these kind of targeted you know, engagements with people across the city, you know, and in different communities as well. So I'll end there.
Great. Thanks so much, Katie.
Thank you.
Maybe now I could just call upon Srinivas to share a few reflections and probably have a discussion between the 3 panelists before we open out to the wider audience. I'd also request everyone to please keep adding your comments or questions in the chat window. So over to Srinivas.
Thank you, Rohan, and core organization for setting up this very important conversation. It's I'm sure when you have organized or scheduled this particular event, you haven't probably imagined the times that we'll find ourselves in on this particular day as the second wave hits us, maybe in some cities much worse than other cities, but here we are once again, right? And I think we, on behalf of citizens of all states and India, I think we must take the officers like Mr. Dhananjay and scores of others across India that have gone beyond their call of duty, and as very nicely captured by him and in Katie's research, the police were never. And yet, when the situation evolved, they were ready for it, and it wasn't easy, challenges to begin with. But we've come through that. We've gone through that process, and today we are sitting here and discussing the research of it, the post analysis of it, and what else can be done at it. And when I hear Dr. Dhananjay talk about, how else can police support the community, I think it's just a really good place that we all find ourselves in. That we've discovered something as a result of this that can be put to good use for many other things that happen in our day-to-day life. Janaagraha, as many of you know, is focused on cities and transforming the quality of life in cities, and among other things like planning and participation in local decision making. One of the key beliefs that Janaagraha carries is the decentralization of community policing, citizens to be partners with the local police and police to be partners with the local community. So we've been working on it for quite some time with the help of some wonderful officers and progressive thought leaders.
Yeah, so I think we were going to do a little informal discussion. So I would love to hear from Dr. Dhananjay about whether he has any ideas about how we can kind of give greater credibility to citizens who work as volunteers with the police, to kind of enhance the public's embracement of these kind of volunteers. And if he has any thoughts about reactions the public had when his volunteers were calling out to citizens, and whether they had any questions about, authority and who was calling them and why.
Absolutely valid question. Basically, we had very funny instances around it, as well as some sad ones. Once it so happened, I'll just recount one. There was a couple, and the wife was infected, and one of our male volunteer would call her, and the husband was really annoyed. Who are you, and why are you calling my wife? And it was a hilarious situation. So we had to really tell him it's very much from Assam police side. The thing is, because these volunteers tend to call from their own numbers, which are private numbers, and people do not have any mechanism to identify. So eventually what we evolved is when a person is being placed under home quarantine or isolation, whenever he or she is tested positive, we would give a handout, and in the same handout we would mention that somebody, please expect a call from somebody identifying himself through Assam police. So it was kind of password, so people would identify that. And in case further you have any questions or problems, please, this is 100, which is the Assam police's number, so which is known to everyone, so they can call in, and we would certify that. Despite that, we had a few issues where people were simply not comfortable, and we took it as a decline of the consent, and we did not go ahead with it.
I think a lot is about awareness, and like you say, kind of preempting that somebody might call you is a useful, definitely a useful thing to do. And just, elevating the status of these people in the sense of making people aware that these people exist is definitely useful. And perhaps maybe some kind of identification that allows them to kind of cross-reference back to a police station if they have any doubts might be a useful thing to do as well. And so going forward, especially now that we are in another wave, have you harnessed these volunteers? Are you keeping them on board with you and keeping them engaged in activities as the kind of nature of what things are needed changes, as we kind of go through the months?
Yes, now again, with the second wave, we are contemplating the same thing again. Assam is slightly and thankfully behind, statistic-wise, we are behind the rest of the states or rest of the world. So we have some more time to think and flock together. And this time we need to really improvise upon it. But as of now, there's no plan as such. There's no formal plan from the government side.
And citizens themselves in Assam have picked up on this model and understood and have been grateful towards the police, or what's the public's reaction been to you?
Yeah, very much, very much. People like this idea. Somebody's calling in, plus somebody's helping out. So there was a backup. I think the best credible part to answer to your first question as well as this question is that when we back up, our say with the action, then people tend to believe a lot. So if somebody's distressing and telling us that I'm not getting ration, I'm not having food problems, and in a couple of hours we are able to mitigate the problem, then people tend to believe us.
Yes, makes sense. I'm just reading in the chat box. One point Saurabh Raj has asked is about the coordination with the health department through different departments and teams working together. Was the engagement with the health department missing? It's a question here, or was it there? I mean, Mr. Dhananjay could probably answer that. And then there's another question, and just come to that in a minute. So maybe you could answer that question first.
To answer your question is that yes, we had a wonderful coordination with the health department. Initially, there was a resistance. They said, why should we share this data? And then we had to take the intervention of the highest officers. We assured them that we are going to get back. There won't be any misuse. Then we signed the NDAs. That was quite natural on their part also not to part away. But as the results started coming back, they were more than happy sharing the data. The coordination was more from their side. Then to answer your next part of the question, there was another similar helpline by NHM. But then, that was not probably, they were into too many other things, coordinating among various departments. And we devised completely the different charter of work. We would focus on the citizen end, and that helpline would focus, and they would receive the calls. So they were always a passive. They hardly made any calls, and they would give us the data to call. Why? Because we had a very trained set of volunteers who knew how to initiate a conversation. If somebody was in distress, how to go about it. If somebody was okay, how to go about it. And I think this trained aspect was more important, in taking people into confidence as well.
So just as a follow-up to that, did you reach out to them to offer your help and support? Is that how it kind of transpired in terms of making these calls and things? Did you reach out to the health department? Because I know you said that initially they were unsure about whether they should share data with you and things like that. So it was your initiative to reach out to them to help them?
Yeah. We initially reached out to them. It began very humbly, actually. There were a set of cancer patients in particular, and there was a cancer NGO working in my area. So it was health department who came back to us and saying that there's an NGO, came back to police saying that some cancer patients are facing problems in accessing the medicines. Is there any way you can monitor and help them around? So we did, but as the number grew, we ourselves contacted this NGO, this cancer NGO, and then it was a successful model. Then we eventually thought that why not extend it to non-cancer patients and everyone. So that way, we faced lesser resistance. It was accident rather, it was a discovery how we unfolded.
Interesting. I think Saurabh himself has raised his hand.
Yes.
I'm happy for you to unmute and ask.
Thank you, sir. Thank you, Dr. Ghanwat. It's really good to see somebody coming from your side and talking about the engagement with the community. And I can very well understand on NHM part, means the health department part, because the taboo which was there in the beginning of this pandemic of having their name disclosed in the society, being affected by COVID and home quarantine, home isolated, they have this thing very much going on. And that's not only in case of Assam, but there are other states which are struggling with this issue, still grappling to overcome this kind of taboo of society stigmatizing them coming out of their home and all. Sir, just one sort of input to you when you start engaging with the health department again, because the counselors there with the health department are well trained on the psychological support and psychosocial support, which they actually interact with the patient in terms of the stress which they undergo through. They might not be able to help in terms of the livelihood and the economic part, but especially in terms of health part, how to manage that stress, what all a smaller medication one can do at home, actually might help you in your work in this second wave of COVID. And one personal experience that once I traveled back from my field visits and I got a call from because I'm calling from Delhi. So I got a call from Delhi Health Department, and they checked with me that did you travel, what are your details and all. I myself was very skeptical in this kind of technological world where people use your data for many other fraudulent activities. So I think this need to be at your end. You are the one who actually look into these kind of internet based fraud which happens. So you yourself can look into a different aspect how this can be mitigated when you call to the people there in the society. Thank you, sir. Very nice listening to you.
So thank you, Saurabh. You had very, very valid points there. You also recited your own experience. How does it feel like receiving a call from unknown number and coming to terms that somebody has your name and your data and somebody? Yeah, that's obviously not a pleasant thing. But that's what we trained our volunteers. In the very first call, they would identify themselves calling from this initiative of Assam Police COVID Sentinel. Then they, if required, they would show their iCard or photo or somebody, but photo and video people were absolutely not comfortable initially. But it is both good and bad, crime part will be there, we have to take card, but that's really minuscule. What happens is, recently we had in the month of December last, we had another follow-up with all these volunteers electronically. We had a webinar and we asked to recount their experiences. So now they told us that most of them are still in touch with their set of people. So they formed bonds which were beyond those 7 days. That's really heartening to know. The second part, yeah, definitely will take part of the trained counselors in the NHM call center. But what happens, there is always some difference between somebody calling from the government side and somebody calling from the volunteer society. So this volunteer typically tells that, look, I'm a student studying in so-and-so college. I also faced the COVID last year. I just stay in the next neighborhood of yours in that other district, and I'm really concerned for you. So that gives another set of freedom for people to engage with. People are rather scared when they identify themselves calling from police side or from government side. So if somebody taking your example, if you get a call, two calls, both from unknown numbers. One number says that yes, I'm calling from Delhi Police and I'm here to help you. Your response would be yes, it might be trustworthy, but you will be still on your guard. Another number calling from within the community. If somebody says, I'm professor of so-and-so Delhi College, I'm calling on behalf of Delhi Police. They have engaged me to talk to you. And then once you establish their authenticity, then your response to them tends to be better. You tend to share with them more better. That's what our experience is so far. Of course, that needs to be more refined with the data. But I have not seen any misuse of the data so far. No cybercrime so far. Yeah. And then we can track. We know precisely whom we had given this data. We have that, and we have warned our volunteers also, because they tend to be students and we cannot be watching everyone. We told that if there is anything, there is always a mechanism when police can come back to you. So better do not do that. And then we took a lot of care, in giving numbers. Only the ladies would call the lady beneficiaries. The same age group would be there. Same mother tongues would be there. We took a lot of care in. It was not a randomized distribution.
Exactly. Thank you, sir. Thank you.
It's really good to hear. And I think that's obviously the basis of this kind of volunteer model, is that it does help people open up and share where there may be doubts or concerns about sharing with the police directly, So yeah, I think Srinivas also has his hand up. Do you want to add something, Srinivas?
Yeah, sure. Can you hear me, Katie, now?
Yes.
Okay. Now, I wanted to ask Mr. Dhananjay, based on the experience from last year, what would be your suggestions to police department in general, not just in Assam, but everywhere, on what kind of sensitization or orientation needs to be given to police at the recruitment stage itself, when somebody becomes a police officer or a constable or an inspector or any of those different roles? Do you, as a result of your experience over the pandemic policing, do you now suggest a different way of inducting new police staff into police, and what would those things be given where we are today?
To be very frank, that's a very broader question. I did not myself dwell into recruitment stage, but yes, naturally the police now needs to be oriented themselves more about the community problems rather than just the crimes. It was always there, but generally police would help people when there was a distress, like some natural disaster or something. Pandemic something which we were not really prepared. But now this is a very clear kind of, like I said, it is a new COVID has set in a new social order among the police and the public. And that social order is more to come in the coming days, I believe. Police will be seen as, the first responders for every kind of activity, and we better be prepared for that. Then we need to go a lot. We need to still do a lot on our soft skilling. We need to talk to people normally, even during the crime part. even the other charter of our works, we need to be, when we are doing the verifications, we need to have a lot of soft skilling. So in fact, now we are thinking, why not have a front end, which is having a front end of such call center people who will be part of the policemen only, to have our own kind of call center, who we already have that, but still in a larger way, to engage with the citizen in a particular manner. We need to change the new frequencies, I think. I mean, I'm confused a lot. At this stage, to put in a very clear answer.
Sure. All right, understood. That's understood. I think we have a long way to go. In terms of implementing lockdown using a method of policing, rather a stricter enforcement by creating barricades or I forget the word that you used, but physical stops where there is actually stopping of a physical movement of citizens, during the normal times for 144 section or other particular events versus the pandemic times. What is the thing that you noticed that could work in our cities and our towns? What can we, another way of asking this question is there any awareness or communication that we should be doing, messaging? So the amount of policing that we need to do becomes bare minimum, and a small percentage of people are unaware and are trying to, or are intentionally or unintentionally violating the, stay home or lockdown kind of norms. Are there things that we could do so the pressure on the policing system is reduced? What would you think we could do around that, particularly in the context of today with the second wave raging through, and the Honorable Prime Minister and many chief ministers have repeatedly said that we don't want to go in for another lockdown. Now, if you don't want to go for a lockdown and yet you want people to, stay home and not roam around, causing a further spread of the virus, then what can we do?
Very, very pertinent question. This is what is blogging us since last 1 month. Like we had a video conference with our DGP and all the SPs and all the senior officers, and the sole theme of this was, how do we go about it? So the deliberation, if I may share out of it, in the public interest, is that we clearly thought that the strict enforcement which we did last year initially would not do this year. It's not the best way, probably understood that wielding lathi is not the thing, because this year again it's not a lockdown as such, it is not a curfew as such. So then how do we go about it and to bring a behavioral change in people? So I think this time we have thought better strategies. We have thought that we'll go in a very strategized manner. We'll catch the niche segments of the society. For example, the shopkeepers, the Chamber of Commerce, the rickshaw pullers, the skilled migratory workers, and so on and so forth, the students. So we would engage community according to their niche work, and we would focus them. It will be both generalized awareness propaganda as well as engaging them in their own workplaces. So now we are going to markets where we are telling them in a very, very soft as well as strict manner that these are the fines, and we would realize at the same time we have taken a conscious decision that we are not going to fine anyone who is apparently from the lower economic section. We are not going to, rather we are going to extend the masks. So that is a sort of humanitarian as well as Gandhian method to change the behavioral this thing. But there would be some 1 or 2% elements who require some stricter measures. That's always there. So them again, we are not going to beat them physically, because that's not the best way to do again. So for them, we are thinking that no matter how powerful they are, they'll be brought to police station. They'll be made to sit at least for 2-3 hours. If possible, we'll engage them for community service, like come join us in the nakas with us. You have to spend 2-3 hours, and I think that is the best punishment we could give to them. That's what we are thinking. Let's see how it unfolds this year.
That's great. Yeah. So, Dr. Dhananjay, we do see that the methods of policing have changed. Distributing masks instead of wielding the lathi, making people do physical exercises, hops on the street. We see a lot of these very disturbing images coming from different parts of the country. And while I can understand the frustration of policemen trying to convey a message, they should never forget, the role of police or the rights of the citizens and so on. It's a very sensitive topic, and that requires wider consultations and conversations. Going back to the earlier topic of a question somebody made about the data, what measures are you taking in Assam Police or police in general to protect and the privacy and data and delete the data, right? Now that you're done with whatever work you've done, are you ensuring that the data retention or deletion has been done? Is somebody held accountable for that? You mentioned in a positive sense that there haven't been any cyber crimes, but the nature of these things is that you may not see them instantly, right? The data might leak, and next month or 10 years later you might have a problem, or something else might come in. So have you thought through this? Are you working with any experts on this, and what are your general thoughts of data retention and deletion? Because once you involve community or even different levels of police themselves, you never know which hands the data goes into, and what the consequences of that are. And has there been any serious discussion around this?
No, frankly speaking, not. That is because the entire, the data regime, data protection bills, data sovereignty, these debates are still, upcoming in our society, both legally and as well as in the conversations, in the transactions. We are conscious to that, and to that effect, we make appeals to people. That is why we went into that NDA agreement, so that we can still hold somebody responsible. We are again and again appealing to our volunteers that look, we know whom we have given the data, and now we catch on. But beyond that, I think we have not yet taken any measures. I'm just being candid here. Sometimes we want the data also to be retained, because we would go back to these people again, maybe next year, maybe 2 months later, we'll conduct another research. The research could be policing research. We would simply give them bulk SMS and ask them if they noticed any crime because of the last year's COVID Sentinel project. So we require to retain the data. So deleting them is not in the best interest, I believe.
Okay. The last point I wanted to raise with both you and Katie is that about policing in the cities, right? I think Guwahati is a big city, and I'm sure there are other big cities in Assam also. There is always a discord or a gap between the city governance, the municipal governance, and the city policing, because usually the policing comes under the state home department, home minister, and so on. Absolutely nothing to do with how the city itself is governed, like the mayor and commissioner. There is no connection between, for example, in Bengaluru, we have about 200 wards and 100 police stations. There isn't jurisdiction between the municipal governance, station maps and so on. How important is this to align for better coordination between all the things we talked about, community participation, connect with the local citizenry. So do you think that there is a need for a better alignment between the city governance and the police administration? And should that be legislated? This question is more of Katie's, but Dr. Dhananjay, you could answer that too. How important is legislation in this based on your research?
So actually, I don't really want to address the question of legislation and alignment from the point of view of how easy or difficult it is for the police to do their job. I think that might be a better question for Dr. Dhananjay. But looking at it the other way, this misalignment of blocks, between, it's there across the board. It's not just, police zones versus wards or polling stations. Across the board, we have a lot of misalignment with the way that our cities are kind of quartered up and blocked out, and that does have implications across the board. For example, if the corporator is not matching the same zone, or not clearly, the corporator zone doesn't quite clearly match a policing zone, it has issues and implications not just for police but for other service delivery, water, sanitation, electricity, all across the board. There are issues like this, and internal. So if you wish to stimulate citizen participation, how are you going to identify the citizens that live in your zone? Because, for example, the polling part wouldn't match the police zone, and the polling part's probably the best and only place, and at that, not a very good reflection of citizens who live in their jurisdiction. So how can you ensure that the police captures all of the community when those blocks misalign? And I think from that point of view, it's very difficult to make sure that you basically capture everybody if you want to participate, or if you want to encourage participation in that way. You don't sort of have some kind of baseline of who actually lives in your zone that's easily accessible. But the other question of how that kind of impacts how the police do their job in terms of lines of governance, I'll leave that question to Dr. Dhananjay. Our research didn't look at that at the moment.
Okay. Yeah, just to clarify to Dr. Dhananjay, the police chief of New York City reports to the mayor of New York City, and the police chief of Madrid or Paris report into the mayor of that city, and not to somebody else in the government, right? This is what I'm referring to, sir.
Yeah. So basically they have a different charter and they have different policing system. Here we are responsible to the codes of law more than developmental activity, because that is our charter. That's why we don't work as closely with the civil authorities. Having said that, there's one area where we converge, and that is whenever somebody applies for any government schemes, projects, or some kind, even the driving license, it invariably in the passport, it invariably comes to police for verification. So we are supposed to certify whether this element has a clear history, or does he or she have any criminal antecedent or like that. Which means now there is always already a mechanism where we want to verify somebody. So with the growth of data sciences and the fields like that, there is ample scope, both technologically as well as legislatively, which your question is essentially about, to have a convergence and to have a regime of incentivizing people who are good, who are paying their municipal taxes on time, who are creating less pollution, abiding by the city waste disposal norms or parking lots and this and that, and disincentivizing those who are breaking these lines. So we have ample data of traffic violators. Can that be used to prioritize people for as a good behavior, so that they get some facility better than that, or they get some tax breaks or some points or some community this thing. So there are innovative ways of going ahead, and they will have to be backed up with due legislation as well. There's ample scope with this convergence of data, but of course that comes with its own set of controversial aspects. But going forward, yes, there's ample scope. We must think that way, how we can align together. But I don't.
You think there is scope for improvement in governance of a city, right? You'd agree with that?
Yeah.
Okay. Thank you so much, Dr. Dhananjay and Katie. Rohan, over to you.
Thanks so much, Srinivas. Those were some really fascinating questions. I have one question that I want to ask. My question was around particularly this, right? As you said, that if there can be a grade to say there is someone who can be a better citizen and someone who's a lesser citizen, we already know that in reality, our relationship with the police or the policing system in a way is fraught, right? Our relationship with what we think is legal, illegal, whether we have like legal rights to occupy sort of space. There is migrant laborers. There are people who live in squatter settlements, etc. I wanted to understand, particularly from both of your experiences, these are citizens that you engage with who would be volunteers. Like, does that naturally mean that they were people of a certain kind and a certain section of citizenry would be completely missing in this conversation? People whose relationship with the police is so fraught that they wouldn't even sign up for an exercise like that. And I want to sort of ask this particularly from the point of view that I think this framing is really, really valuable. Like, how does one balance ruthless enforcement with the humane heart, right? And I think there's something really powerful there, and just some of your reflections on whether in voluntarism, in voluntarism for policing work, are there any hidden or missing populations altogether?
Yes, there are. We are not able to engage with all parts of the community on equal footing because we don't get equal responses because of the different socio-political reasons, backgrounds, their understandings. But we need to build on that only. We need to identify such pockets where we are having lesser interactions, and we need to improve upon that. We need to identify such people who are voluntarily keeping out or having a strained relationship. But Rohan, that's a very idealistic thing to expect right now, because right now we have a lot of other problems. We have a very adverse police population ratio and a whole lot of police reforms that are required. As simple as the soft skilling part, which I was talking about. Now, every police organization is really conscious to this fact that we need to, first of all, make behavioral changes in our outlook. And that I'm sure is happening in last 5 years. If you just close your eyes, I'm sure the image of police has been getting improvised everywhere. There are instances of riots happening over the country, but still police have been showing a lot of restraint, and the things are happening. But a lot needs to be done, and it's a broader question of police reforms, I'll say.
Yeah, I mean, just adding on from, let's say, a gender perspective, I think as Dr. Dhananjay alluded to, if you want, for example, to have more involvement from women in your local community, it is important that that your police force also reflects, greater proportions of women, for example. That's a simple explanation beyond a simple example, sorry. But beyond that, we didn't really look at the profile of volunteers particularly. So I wouldn't want to comment any more beyond that. But definitely when you're looking, obviously, at participation and communication, although our research showed that the police were very effective in reaching out towards women during the pandemic. Although one or two did mention that they would like to see more female police officers. So I do think, making sure that there's a greater profile of different types of people certainly helps, definitely.
Interestingly, now we have 33% reservation for women in Assam Police since last, and that means a lot actually. At all levels of recruitment, we are going to have that proportion. Madhya Pradesh Police in particular recruited last year a few transgender policemen.
Great. Thanks so much for firstly all of your time to the panelists and also to everyone who joined us for this really rich conversation.